Larry, it is so wonderful to join you today, and thank you everyone for joining Larry Trotter II and myself, Tanya Zucconi. We're here today to talk about the Dime Digital Medicine Society's AI Playbook, and we've broken down their playbook into the three categories that Dime presents, and today we're talking about the second one, which has to do with selecting a vendor and selecting tools and technologies, and we're really, really excited to get started today. So, quickly, a little bit about us. I'm an AI advisor and operations SME, and I've been in the healthcare space as a non-clinical advisor for a number of years. I'm located outside of Boston, Massachusetts, in the United States. And I'm really excited to be joined by Larry Trotter, who I will allow to introduce himself in just a moment. Quick note and some disclosures. Neither Larry nor I are employed by Dime, which is the Digital Medicine Society, headquartered here in the Boston area. But we are fans of this AI playbook that Dime put out earlier this calendar year. And so we've taken a couple of sessions here on LinkedIn in order to talk about it and be advocates of this particular tool. So, Larry, a little bit about yourself.
Yeah, thanks, Tanya. Hey, everyone. Appreciate you. We appreciate you for joining. Today's going to be a fun session when we actually dive into choosing the right tool, right? We get into the meat of it. But my name is Larry Trotter. I'm the founder of Inherent Security, and we specialize in HIPAA compliance and cybersecurity. And we work with health tech companies, primarily helping them build the right solutions securely and also choosing AI tools securely as well that they can sell the health systems. A lot of fun today. Can't wait to join.
This is
To
going to be
start.
great. So, Larry, I think what you're going to do is share your screen and you're going to pull up the tool. So, if anybody wants to follow along, they certainly can. So, this AI playbook that is put out by Dime is an online interactive tool that is broken down into three sections. In the first session, Larry and I did a while ago, we did an overall introduction to the whole playbook. Then we did a deeper dive into the first section, which was really about identifying the problem that you're trying to solve to make sure that you have a problem that's appropriate for AI. Today, we're going to talk about choosing the right tool, which includes the right vendor or partner. And then in the final session, which we will schedule soon, that's going to be talking about actually implementing the tool. And this is a cumulative type of exercise. So before you jump into the choose the right tool, you will have already completed some of the tasks and exercises under the first category around assessing your organization's readiness, identifying where you are in the AI maturity curve, and so forth. And all of those are built in under the identify the problem section. But you can see that Larry has us here under choose the right tool. Larry, if you'll just hover over that section heading for a moment, that would be great. People can see that there are three different sections under what we're going to be discussing today, talking about the workflows. Those are the stackable wins, talking about whether or not you should buy, build, or partner, and then finally looking at actual evaluation tools and approaches. So, Larry, I'm really excited for today because I think one component of this section that is perhaps underrated and definitely receives not enough attention is around security. And I think that when folks are trying to figure out, well, what tool do they want to buy, what technology, what partner, security is not top of mind. So I'd love to have you chime in at any point with comments that are going to be security specific.
Absolutely. Yeah. And this is the perfect section to actually, another perfect section. But since it's the meat of it, right, we really want to make sure that we are accounting for the security capabilities internally if we're actually building this in house, or the vendor capabilities if we are buying the solution or partnering.
One thing, then we'll get to this when we get to the second part of this section, but I think it's important that when folks get to the section about do you buy or build or partner, and those can be somewhat overlapping, right? So when you're
Right.
partner, you're usually partnering with a vendor from whom you have bought, will buy, or that partnering is a part of that contractual arrangement. You have any number of factors that you have to consider, and then those are listed. There's actually a great kind of list in this tool, which is, again, online, interactive, and free to everyone to use. So please go to Digital Medicine Society and you'll see right at their top banner, this is one of their newest resources released. But for me, trying to make a decision about do we buy, build, or partner, there are any number of critical factors. For me, one of them comes down to is urgency. But we will cross that bridge when we get there. This is a great place to start because unlocking cumulative AI value in workflows This goes to the first pieces of data that are available when you jump onto the website here, and they talk about 80% of AI implementations fail. We know that's true of any implementation, AI or otherwise, right?
Right.
80% fail. So I think one of the reasons that they identified, or actually the most important reason that Dime identified for these failures, is a lack of alignment between whatever that tool or technology is that's being brought in and provider or team member care team workflows. So if you can't take your product or your tool and have it align with those workflows, the likelihood of it being adopted is very, very small. Unless for some reason those workflows are inherently broken and you've been asked to come in and really help them rethink what that looks like, which isn't often the case, right? Often they want to augment what they have, not replace it. Larry, anything to add there from a security perspective?
Workflows, well, I don't know necessarily from a security perspective. I mean, there are security concerns, how the tool access controls, username, passwords, that sort of thing. If we're using single sign on, all of those considerations when integrating into workflows. But I think it's really going to be dependent on the solution that the specific solution that we're talking about here. But what I like about this is when you start talking about the stackable wins pyramid and the different use cases and the risk involved with integrating AI at each one of these levels. And I love it because it really points out, now we're talking about security risks, right? We can get into it because if we're using personalized or precision AI, that's going to be something that's really critical. And that system, the controls, security controls around that system are going to need to be very high versus something like an AI scribe that's on one of these lower tiers when you talk about clinical documentation and workflow assistance. All of them need some level of security, but when we talk about security, everything is based off risk, right? We can't completely eliminate the risk unless we don't buy the tool at all. And so in terms of AI, we would, have no risk in that respect, but we want to lower the risk. So the higher the risk the system is, the more security controls are that more security controls are usually implemented on those higher risk systems than the lower risk system. So that's one of the, I would say, the primary considerations in terms of security when purchasing or implementing these tools at one of these different tiers. The more controls that you implement means the more resources that it's going to take, yada, yada, yada. And we'll get into that a little bit later because in here, they have this one of these pro tips, which I love. It really kind of points out the total cost of ownership, and
Yes.
they've broken it down. We're not just paying for the licensing here. We're accounting for resources. We're accounting for infrastructure. We're accounting for personnel, all of these different aspects that pile on. And when you see that annual cost of what it really, what the real financial impact is, that's really going to help drive your decision too. But the stackable wins pyramid is great if you want to dig a little bit deeper into those.
I like this, Larry, because the base one, the high volume administrative tasks, it's the largest part of this pyramid. It's the foundation of the pyramid, and it's what we often refer to as the low hanging fruit, right? The easy
Right.
wins, the early wins. You want to be able to take a challenge that is easily solved, hopefully has high impact, right? Low
Right.
risk, to your point. And you can see that from the examples that they've listed here. And obviously in healthcare, those that are not patient facing or that are less likely to be patient facing or don't have clinical impact, even if they are patient facing, are where you want to start. And this is true across technology, whether it's in healthcare or other highly regulated industries. But the stackable wins allows you to get the early wins and then move to the next most complicated layer that's appropriate for your organization. And remember, in the first part of the Dime AI playbook, an organization has already identified what problems they think they want to try and tackle using AI. They've determined that those are appropriate. They've determined that their own organization is ready and is at an appropriate place to bring on some new technology. And to your point, Larry, the total cost of ownership is very significant. And too
Very.
often, when an organization is thinking about a new technology, they're thinking about, well, what is the per user, if it's a subscription model, what is the per user cost, right, per month? And it is so much more than that, so much more than that. And some of those
Right.
tools in the first section help you get prepared for what you'll see in the TCO in this section here.
And there's one thing I want to point out before you move up this scale, the stacks. is that, in my opinion, this right here, I know it's an example, but initially we were talking about identifying the problem and if the problem really, you really needed AI to solve this problem, right?
But
So what I see here is patient registration. In my opinion, you don't need AI for patient registration or appoint. No, more along the lines of appointment reminders. That's something that you can automate based off the tools you already have. And why I say this is because when I go to the doctor, I get automatic appointment reminders. I don't think AI is a use case here, but there are broken processes in that workflow that I have noticed as a patient myself that needs tweaking. But I just want to point that out because I was going through this earlier and I was like, yeah, this is the perfect example where I don't think you need AI for this. It's either a workflow issue or you already have a tool that's existing that can do something like this. So it's kind of me ranting off, but I think it makes sense.
no, I think that's important, Larry. And what I'm going to say about that is this: I think that often organizations have AI enhanced tools available to them, but may not be aware that they are, in fact, AI enhanced tools that can help them with what they're doing. So, to your point, there may be an electronic health record that has the ability to provide patient communication, but it's not been enabled.
Right.
And so the organization may not be aware of it. They don't need an external tool to bolt onto what they already have.
Right, right. And I see this all the time with security, the same thing. One of the things I try to do is save my clients money. So I say, let's look at what you already have. Because a lot of times these tools, what you're trying to purchase is already a feature in an existing tool that you might have. So let's
Right.
inventory what you have and take a look at that first. You're absolutely right.
Yeah, you're right. So that's why if a company comes in, if a healthcare company comes in and they've identified that patient reminders is the problem they want to solve, you're going to go right to their tech stack and say, well,
Exactly.
what is your EHR, your electronic health record or your electronic medical record? And what are your, patient relationship tools? And what are your care management tools and your care coordination tools? And hopefully there aren't too many of those. Hopefully they're using one for many of those. And you can say, are you aware that this exists? And maybe. So I think that's a really, really good point. And I think that's a good point about this playbook in general. So these are all examples that Dime has provided, but they are not the only examples and they may not apply to your particular situation. So take this with a grain of salt. This is a good place to start. I think it would be great to just hover over each one of these, Larry, so we can show the viewers what the different examples are. And yep, so here's the second one. So once you get rid of the high volume administrative tasks, whatever is appropriate for you, then maybe you're going to start to work towards some of the more clinical activities, right? So we all know what pajama time is. We would love to reduce the pajama time for our providers so that when they're in their pajamas, they can actually be with their family or watch a movie or enjoy themselves without having to be working on notes, right? Or charting for the next day. So what I like about this is that for each of the different stackable levels, Dime has included categories that help you think about the use case, the role of AI. Does it have to be integrated? What is the relationship to the workflow, the value, and then some additional notes so that you understand the flow. It's a nice step ladder from one to the next. High governance burden. This is really important here because people don't often
Oh, yeah.
realize that when they're talking about taking on more clinical challenges to try and solve them with AI, they're going to have to work with their privacy team and they're going to have to work with their regulatory team and they're going to have to work with their risk management team because there are a lot more concerns that come into play about the data that will be involved. And we all know garbage in, garbage out, but this is a critically important one. Now, this next one, the predictive and diagnostic, I find this one really interesting, Larry, because larger health systems, and maybe less so community health centers, but certainly larger health systems and vendors who work with those larger health systems have been using predictive analytics. Think about a regression model to help identify patient populations, right? It might be a population of patients who haven't had an A1C in the last 6 months, right? And that's going to be a list of patients who are rendered in a registry or a roster who can then be acted on either by a nurse if that their last A1C was out of range or trending in the wrong direction, or perhaps could be intervened upon by a population health manager if the issue is just that they haven't had an appointment set up in the last 6 months to have that test done again. AI has been used for decades in this way. And while this is right in the middle, I think it's an interesting one because a lot of people, I think rightfully, want to understand what data feed into these models and how it will be used. Who's making the decision? Is it AI making a decision or a provider? And we both know that AI is best used when it augments clinical decision making as opposed to directing clinical decision making. But this predictive one, I think, is interesting. Personalized and precision AI, we've seen a lot in the last 5 years around CRISPR, around the ability to treat diseases like hepatitis B, like sickle cell, where an individual patient can have treatment tailored toward them. And a lot of that is going to be based on data that are crunched through algorithms that can be done far more quickly by a machine than by a person and more accurately, and give a head start to the team that's actually developing the intervention or the treatment.
And one thing to note here, right, is the high complexity to
Mhm.
actually implement this. So you're going to be talking about changing workflows, which we all know is very important to clinicians.
Yep.
So when you're introducing something like this, that this usually means you have really thought it through, started from the bottom, and you have adopted AI at some point if you're going to jump right into this. And also because there's a low immediate return on ROI here. So that
Mhm.
means it's going to take a few years before you actually see something coming back. So again, you've kind of already created this hamster wheel with AI starting from the bottom and are seeing the ROI at the earliest stages of this pyramid and able to accommodate and actually weather the storm when you get to personalized and precision AI.
Think that's a good point, Larry. And it's interesting because this is a nice visual pyramid with each of the levels equidistant, even though not of the same size, obviously, for the pyramid shape, but there won't be the same amount of time as you go from one stackable win to the next, right? To your point,
Right.
you get to that personalized and precision AI, and that ROA could take years, right? It's not going to be
Right.
weeks or months. Yeah.
And the investments, total cost of ownership at this level, yeah, it's going to be really high. This is
And that's
nothing
really
you just
hard in
jump.
healthcare, right? I mean,
Yeah.
it's really hard when margins are so small to start
Yeah.
and you've got so many regulatory and environmental concerns that change within a few months, right? At least right now in the US, it can be challenging. So this is great. This is nice because this section goes deeper into the workflow. So you really have to know what your problems are that you're trying to solve, and you have to do a current state assessment to know where your organization is with regard to it. So what are the challenges that you want to try and solve, these use cases you've identified? What's going to help you get there, an enabler? What's going to prevent you from getting there? Those are the barriers. And then really what's that ROI, the business value? There you
Yeah.
go.
Next section.
There you go. Moving on to the second session. So, this is a lot of fun. So, do you
Yeah.
buy your solution? Do you build it? Or do you do something in between? So, this is a fantastic table or matrix that helps outline some of the criteria so that you can get a little closer to the answer. This is not going to absolutely say this is the answer for you every single time when you have a solution that you're considering, but if you look, for example, to the time to value, the second line item there, the second criteria, this is a critical one because if you say, I need a problem in the next 6 to 10 weeks, well, obviously you got to go buy it,
Right.
all other factors being ignored, which isn't the case. But these are not all the same. The criteria don't have the same weight or the same value. And that's something they talk about a little bit further on. But I love the way they have described each of these. And in a latter part of this section, Larry, what they do is they actually say, don't forget to ask a variety of stakeholders, right? So when you're trying to decide about an AI tool, you're not going to just talk to the IT team. You're going to talk to a variety of stakeholders. But are there any criteria that really stick out to you here as critical or as perhaps being more highly weighted for you, Larry?
I love the total cost of ownership. This is really
Mhm.
highly weighted. And probably I'm a little biased on this, but in general, right? As we talked about before, all the different types of the different considerations when adopting AI is going to really increase that total cost of ownership. But internal skill requirements, I like that as well because what we have listed here, right? Data scientists, clinical informatics, DevOps, security, right? You're going to have these different internal skill requirements, the maintenance responsibility, right? Let's start with security, penetration testing, patching, risk assessments, on and on. And then we also have updates, retraining, and they broke it down depending on the model you plan to adopt here. And regulatory burden now. So they have compliance, validation, safety reporting, all AI governance, great stuff. I would have liked to seen a security criteria in here to
Mhm.
really hone in on that. It really needs its own space. It's buried in here with under compliance and validation. But I mean, regulatory burden, it's just another great criteria to call out in the matrix. This is a great matrix. They did a really good job here.
Yep.
It helps you see all the different aspects, whether you're going to build, partner, or buy. I really think it helps in the decision making process.
And I think you said something really important there, Larry. You said it really helps in the decision making process. It's not going to make a decision for you. You may take this table and this grid and work through it with your own organization and realize we have a really short timeline, so I'm more inclined to buy it, but we don't have the resources that allow us to do that. Now, are we stuck? And of course, you're not going to be stuck. There are typically workarounds, right? There are any number of solutions. You might be able to contract with someone for a short time. You might be able to pilot something with an organization where that really starts to ebb into the partnering, right? And so that
Right.
looks a little different depending on how a contract is actually written. But as you can see, there are some variations here, but this is a great way to get started. And I encourage folks who are thinking about this to take this tool and adapt it. It's not just for AI implementations, it's for working with vendors writ large. So, yeah, these are great. I like that they include the pro tip. These pro tips are really good, Larry. You called that out. The
Yeah,
pro
yeah, they are.
tips that occur, and again, this is interactive. You have to use this tool online. You're not going to be able to download it and have access to everything that you see here. There you go. Who will support this tool in 6 months?
6 months. Exactly.
It is not so and this is really important because it's not just the implementation, and I know that's the next section, but it's not just the selection of the tool or the technology and then the implementation, but to your point, the maintenance. And even if you partner with someone to help support that initially, do you have the right training, education, staff skills? That was one of your issues on that matrix, Larry. Do you have the ability to maintain this? And what keeps coming back to me throughout our look at this playbook, so much of this is about I don't want to well, I'm going to call it basic project management, right?
Right. Right.
It's really about, and I'll just call it project management. It doesn't have to be basic. It's really about appropriate, proper management of projects and understanding what your challenges are, understanding who your stakeholders are, working through all of the different steps, and then planning your post implementation status, which in project management is called monitoring and measuring, right? But
Right.
it's so critically important here. And to the point that you made about early on when you first landed on the page, and the 3 blocks that show up that 80% of AI projects fail. I don't remember what the middle one was, and the last one was about the one reason that most of these projects fail is because lack of alignment to workflow. It's absolutely true. It's about not knowing your audience, and I think somebody once said to me, "Why do 80% of projects fail?" And I said, "Well, there are many, many reasons, but one reason is that when you're partnering with the client who's doing the implementation, they go and they find a champion. So fine, you found a champion at a clinic or in a department or for a regional office. Now, how are you going to scale? Because
Right.
unless that same champion is now going to take on a different role within the organization, you have a wonderful relationship with that one person and you've got great success, but you now need to scale that relationship. And that's critically, critically important and really hard to do.
And one thing I want to point out about this pro tip here is
Mhm.
if you're monitoring something and the dashboard's working great, but nobody's doing anything with it, this is a real challenge. This should be a cybersecurity quote. I feel like it really
Right.
it should. Yeah. Yeah.
Yeah, numbers aren't helpful unless they drive you towards some action, right?
Absolutely.
Dashboards for the sake of having an attractive user interface, they don't do anything for you. This is good. This Health AI evaluation guide is really a fantastic tool. So it's great. It's going to lead you right into how do you evaluate particular tools, vendors, partners. And it's nice because they have you come up with these categories that are important to you, right? And then rate them 1 to 5. You can use 1 to 3. You can use, thumbs up, thumbs down, not sure, whatever you want. But then assign these optional weights. This I have found to be critically important because not every line in that grid, right, is of equal importance, to your point, Larry. And so you've got to have a discussion. And sometimes I have seen this happen where you develop your evaluation grid and then you assign the weight, and then it's a matter of multiplying it out and comparing the scores that either vendors or technologies received. And sometimes it may not feel right. Somebody may come out much stronger than you thought they would have based on the demos that you had with the different vendors. And so maybe you're going to tweak your evaluation tool in the next round for the next technology. You never want to do it just to favor an organization, because then why would you bother going to the trouble of actually having ratings and weightings? But it can be iterative. And again, this gets you started. And I think it's critically important. Healthcare organizations can do this work themselves. They can use internal consultants if they have them. They can obviously partner with external consultants, whether they look like Larry and I, whether they look like the folks that Dime has available, whether they look like somebody you've partnered with before. What's most important coming into this section is knowing that you've identified what the problem is that you think you want to solve with AI, and then working through these different tools. These tools are not hard to use. They don't require any level of technical achievement or accomplishment, or clinical achievement or accomplishment, or financial, right? So these can be used by anyone, whether that person is clinical, technical, administrative, or other. They could be used by a board of directors, in fact, if they wanted to do that. But what do you like here, Larry, about this particular section?
Yeah, I mean, everything you said. I think it's great. I like how they have the sample assessment questions here, who you might ask to
Mhm.
actually help evaluate it, and I like how you can weight it too as well. Kind of as you do this going down, it gives you a bigger picture towards the end and really see, where you want to really where the bang for your buck is. The red flags that we see here too, that the vendor is unable to furnish validation data from a health system of analogous size and complexity. Vendor assertions are predicted solely on internal pilot data. So some of the considerations that some of the, not only the pros, but the cons that you have to consider when making the evaluation as well.
So let me ask you a follow up question there, Larry, because I think this one is always interesting. How important do you think referrals are from vendors if they're established? Let's say they've been around for a while now, whatever that means, and you're a potential client and you ask for a client referral. Do you expect that? Is it a red flag if they won't give it to you? Does it not really mean anything because you figure they're going to give you their best buddies, connection anyway? Talk to me about that.
So, okay, I want to make sure I understand the questions. If
Mhm.
who refers, so if I,
Yeah.
who's
So
purchasing the tool?
so if
If,
the potential client, a healthcare organization, says
okay.
to the vendor, "I like what you're doing. This looks great. Your demo looks good. I'd love to talk to a client who's already implemented your tool."
Gotcha. I mean, that's always a slippery slope. How would I would say really, I would try to in some way research on my own who has used that tool and reach
Mhm,
out without going through the vendor. That way, there's no how do you say it, the blur between the lines by
mhm,
going directly through the vendor.
mhm.
I think that's the best route if you can kind of figure that out. Yeah, it's kinda
Yeah.
tough because, it's just like a referral when you're doing business for the majority of the time. Some, you do good with someone, they're gonna and they give you a referral, it looks great, right? But what happened to those 10 people who you didn't do well with, right? So I think it
Right.
really the playbook in general really helps you evaluate that and make this decision without the referral, and I think that's how you get your that's how you make your best decision, rather than using referrals. But I would take them, but also take it with a grain of salt.
And that's exactly, I think that's key, Larry. That's where I would go to. And I know they talk about this a little later, using peer networks to ask what has worked, what hasn't, for folks. I can tell you there have been times in my career where I've asked vendors for a referral, and their inability to say, we don't really have anyone that we offer up, felt like a red flag. I mean, it's okay My feeling is, as someone who provides services to others, if I have folks who like what I've done, whether it's how I've done it or what I've helped them do, I want to be able to tell other people about it. And to your point, take it with a grain of salt. But if somebody says, I don't offer customer referrals, because, I would just give you my best buddies one anyway, and how much value that feels a little snake oily to me. Someone should be able to say, yes, we've helped 3 startup companies in the last year. I think I can reach out to one and then describe them that seems like they would be best aligned to you. And it wasn't always a wonderful fit, but I think they'll give you a full picture of our experience. Something
And
like that.
and I like where you're going with it. It makes
Yeah.
a lot of sense. And I think if you ask as the customer
Mhm.
versus them, the vendor
Yes.
offering up,
Yes.
holds more weight.
Absolutely. I think you're 100% right because we all know how that can go, right? We certainly
Exactly.
know how that can go. But one thing I will say in the startup space, which, may or may not be applicable to our listeners today, but if you're in the startup space and if you happen to be a startup that is funded, your venture capital or your private equity partners are going to have other companies in their portfolio and they are going to be happy to introduce you. So when I was the
Yeah.
COO of a startup, I was introduced to other COOs at other portfolio companies within kind of the same funding umbrella. And we were able to talk about our experiences because we were all healthcare organizations. So we were doing direct delivery. So when we were looking for an EHR, for example, we would have folks who would be able to speak to that. So use your own network, but ask when you can. Good point. Good
Yeah.
point.
You make some great points.
I think this is really helpful, Larry, to have you walk through it like this. There are so many tools that are useful. Again, the Digital Medicine Society AI Playbook. It's free, it's online. Encourage folks to go run some usability testing, absolutely, and pilot if needed. And there are all kinds of distinctions to be made about piloting versus beta versus a phased rollout. Describe what you want, right? The number of clinics or departments or sites or providers or users to use the tool over what period of time with what measurable outcome in mind. And then you can figure out what label to put on it.
Yeah, and it's just so much here. We've gone through a lot of the meat, but there's so much other additional resources and linked resources in each one of the subcategories. So, yeah, it's a lot for everyone to check out, and I highly recommend you get very familiar with the tool and do a deep dive yourself.
This is great. And Larry, I look forward to our third and final session on this particular playbook, which is around implementing. We'll get a date out to folks soon, but please reach out to Larry or I. We're on LinkedIn. We'd be more than happy to answer your questions and to talk with you about anything you've seen here. And certainly reach out directly to Dime. They'd love to hear from you. So that's what I have for today, Larry. Why don't you wrap us up?
Yeah, absolutely. And thanks, Tanya, for joining. Last thing I would like to say is for health tech, this is something you definitely should pay attention to. This is not just for health systems, right? This is really speaking to you. You all are building the AI systems for providers. So this playbook is really helping you see what they're looking for. And you need to really consider that when you're building your AI solution. So that's the last thing I would like to say. Everybody, yeah, we'll released our next date for part 3 in the next few weeks. We will definitely likely get it out before the end of the year, but thanks for joining and we'll see you soon.
Happy holidays.
Happy holidays.